Hello and welcome to This is Nigeria, Unlocking Our Potential. And we're taking on the Covid-19 situation in Nigeria, the palliative distribution to the poorest of the poor. How effective has it been? My name is Mayowa Uluwabi. Don't worry, we'll be back. Welcome back. If you're just joining us, this is Nigeria. And on the discuss today is palliative distribution in Nigeria to the poorest of the poor. How effective has it been? And how much more can government do? To discuss with me in the studio once again is a social commentator and a film producer, Josie Itoya. You're welcome to the program.
Thank you very much.
And seated next is a legal luminary and a friend of the house, a social commentator as well, Sam Kargbo. You're welcome to the program.
Thank you for having me.
So what is your assessment of the distribution of palliatives to the poorest of the poor?
It's a difficult one because the data is not there, and much of what we know about it and what we can say about it is what we hear those who are involved say in public, especially on TV. Because of also the targeted population, it's difficult for people like us to actually know what is going down there. But I believe that, yes, the government is doing something, but because of the extensive nature of the population they have to cater for, offhandedly I can say those who would fit into that definition or that category could run way beyond 80, even up to 90 million people. And in such a case, you spread wide and spread thin. And I think that is the reason why people are not feeling it the way they should. But I have had recently to try to get somebody to get some rice, for example, from Labana. And the producers there told me categorically that no, they can't sell to anybody because they can't even meet the government's orders, and that the government has locked down almost all production units in the country for their own orders, with a view to distributing the rice to the people who fit into that category. It's a very laudable initiative, but I would also think that there is a lot to be done in terms of the education of the, because they owe it to us for us to know what they are doing, how much of it is actually going to the people, and the cost of the transactions and all of that. And such details are not available, and perhaps that is why people are a little bit skeptical and naturally accents and acrimonious about it. I would also want the government to lay more emphasis in their drive and appeal to private individuals to participate, because like I am saying, if you are to attend to about that number of people, assuming we say roughly 90 million people would fit into that, and you have to spend say 300 naira or 500 naira to those people, it's a lot of money. And I do not think the government has that money, and it is very auspicious and necessary for the government to try as much as possible to reach out to people who would have extra to spare and contribute towards this cause, because without it, it's difficult. I think when we're discussing or in another platform or in another topic, that was the emphasis that yes, because you need to actually encourage the people to stay at home, because you need them to stay at home anyway. As at the time you did the lockdown, because the understanding and the protocols were not there to allow people to just go about their business without actually trying to get a gauge and a serious education of the people as to how they can still go out there and meet the health needs of short interactions. It's, to me, coming back to what I'm saying and what I wish the government would do, is that let there be some form of well-defined targeted audience. If the students are going back to school or the people are going back to school, those populations can be determined. And there could be a reality check on funds thrown into the process and the project. They could well be analyzed and managed. At some point in your life, you could fit into that. Because there could be some day when you don't have money to buy fuel or whatever it is. It's a very expansive and endless definition. And the problem I have with that, and the worry which I think everybody has, is the fact that that definition and its management is given what? To people who are not accountable to us.
We'll go on a short break and we'll be right back.
No nation depends on one source of revenue if it wants to create a sustainable economic development and a future for its citizens. Countries have all grown and sustained their respective economies through non-oil exports, and Nigeria Export Promotion Council, NEPC, is strategically positioned to do more on 22 priority export products under the Zero Oil Plan, the One State, One Product Initiative, and the Nigeria Diaspora Export Program, which are needed pillars of success in our economic recovery and growth plan. Invest in non-oil export business such as sorghum, cassava, yam, shea nut, ginger, and reap bountifully. Export business guarantees a prosperous future through inclusive wealth and job creation. Join hands to make Nigeria one of the top 20 largest economies in the world. Export business, tomorrow's business. For further inquiries, visit nepc.gov.ng.
Welcome back. If you're just joining us, this is Nigeria, and the conversation is still on palliative distribution in Nigeria to the poorest of the poor. In the wake of the pandemic and the lockdown, subsequent lockdown of the country, the government decided to give palliative to people that were considered to be the poorest of the poor. Now, how effective has that been? And what more can government do? Josie, what's your take on that?
What is palliative? It means a way of easing, softening kind of pain that is expected from something. Now, you've asked people to stay back. Like I said, there are persons whose means of livelihood are daily dependent. Now you're taking that off them. I think the fundamental problem we have about the distribution of palliative is we don't have data. As I speak to you, I don't think the Nigerian government have adequate data of the spread demographically, work-wise, age. There's no information. Now, I was expecting that probably they would dig out the last one from the census. At least you have some level of categorization in that report, but there's nothing like that. So how are you going to actually spread down this? But politically, we have structures. We have ward, from the ward to the national. That's how the Nigerian political system is actually structured. So why don't you actually position or distribute the palliative in that wise? Now, like rightly said, you said poorest of the poor. What's the definition of poorest of the poor? It's a transit statement. Today, you can actually be so broke, you're poor of the poor. But now, so what are you using? Someone said,
No, we're talking people who are consistently poor.
So someone said you should probably look at the BVN, those who have less than 5,000 naira in an account should be termed poor of the poor, poorest of the poor. But then again, how many persons in the villages actually have bank accounts? In the UK...
But excuse me, prior to that, I think there's been a cash transfer program to alleviate some kind of social welfare. Yeah, beyond Empower. There's a cash transfer program that's been going on for like 3-4 years to the poorest of the poor in this country.
In this country?
Yeah.
Tagged under what program? Is it Shopee or MP? I know there was Shopee in the Jonathan dispensation, and then there's Empire in this dispensation. And of course, when the vice president was also distributing the 10,000 naira loan. So
Trader money.
The trader money, good. Now, in the UK, those persons were actually, there are some they call vulnerable, those they call susceptible to the disease. Like, for instance, we all know that the older persons are actually more prone to die from this disease. Now you call those people, those are persons that you actually put on vulnerable state, and those who are pregnant. Now these are categories. What about those who are disabled, unable to feed themselves? Now when you talk about poorest of the poor, you begin to come from that angle. Persons who really can't feed if somebody else doesn't show charity. Now, we don't even have a structure. There's no structure, there's no data, nothing to work on. So no matter what the government throws out there, it's every tendency for people to come out and say it's not working. Because it's as easy as anything. If you walk up to your electricity switch and you put it on, it comes on. Everybody knows there's light. People can feel things when they see it. So the fact that you don't have a data to even determine your persons, the spread, the demography, the positioning, and how do you now come out to begin to say you're distributing something? Now you talk about the school feeding program, they are still hammering on this. The truth is, they are not just clear about distribution. And like rightly said, yes, we have an overwhelming population. We can't take away the fact that we are in a dire situation in the country. Our main source of livelihood in this country is actually not doing very well. So what do we do? Like I said initially, what is palliative? For me, it's not just about giving foodstuff and stuff. Even the way you speak to people in times like as a leader, the way you tell them that we are in this together.
Let me put you on a pause. We'll go on a short break and we'll be right back.
No nation depends on one source of revenue if it wants to create a sustainable economic development and a future for its citizens. Countries have all grown and sustained their respective economies through non-oil exports, and Nigeria Export Promotion Council (NEPC) is strategically positioned to do more on 22 priority export products under the Zero Oil Plan, the One State, One Product initiative, and the Nigeria Diaspora Export Program, which are needed pillars of success in our economic recovery and growth plan. Invest in non-oil export business such as sorghum, cassava, yam, shea nut, ginger, and reap bountifully. Export business guarantees a prosperous future through inclusive wealth and job creation. Join hands to make Nigeria one of the top 20 largest economies in the world. Export business, tomorrow's business. For further inquiries, visit .nepc.gov.ng.
Welcome back. If you're just joining us, this is Nigeria, unlocking her potential. And the conversation is still on the palliative distribution to the poorest of the poor. How effective has it been? And we also want to look at the coalition of the private sector, Covid, in this move to give succor to the poor. Sam Kargbo.
Yes, ma'am.
What's your take on Covid? Coalition of the private sector?
I think it's impressive because I've been following almost the generality of the continent. Nigeria has one of the most impressive response from the private sector in the fight against COVID. In Europe and in America, much of what is happening, you have individualized responses. But this time around, you have them pulling resources together and managing the resources themselves, which to me is very, very good because for much of what government would ever do, there is always that suspicion that resources are diverted, and that in itself would undermine the very essence of it. They are managing the resources, but I think they need to also, by themselves and for the good of all of us, to try to recruit as many of them that could have such surpluses to add to the pool. Because, like I said, the government cannot do this alone. It is a call for any individual who can spare, even if it is just a meal, even if it is just 10 kobo out there that you can spare to put out there to help others, it would help.
Okay, Josie, can we have your final submission? What's your advice to for federal government?
In addition to the efforts the government is doing now by giving physical things, I think they should also appeal to the emotional anxiety of persons. And then, naturally, Nigeria, the grassroots of the Nigerian sector, were people that are built on ethnicity and religion. You understand? If you channel most of this palliative towards this institution, I guess it will trickle down. I mean, if you give traditional rulers the power to distribute some of this. So that's why I was actually feeling the federal government should have included these bodies in their PTF. in the task force because people believe these persons. So even the sensitization process should have been handled by religious leaders and the traditional rulers, as well as the distribution. They get to the grassroots. People trust them as well. So I feel they should be part of the presidential task force. And at least let's have more governors, president and all of that appeal to the emotional anxiety of persons. I mean, from time to time, tell them to calm down, you're with them, you understand. Show empathy. Yes, that goes a long way. You understand? But when they feel nobody's talking to them, nobody's telling them, it gets agitated. And then you see people showing you a cup of garrison and say, is this what I'll feed my family with? I mean, frankly speaking. You understand? But then you can explain to them. We're all going through this crisis together, but whatever it is, and like he said, when neighbors give to neighbors, to that, to family members, we are alleviating it one way or another, but the government can appeal to every person. My fellow Nigerians, we can't do this alone. Time to take care of your neighbors. It's time for us to defeat this together. That is nationalism. That is how you defeat the enemy, because right now we are at war. We are fighting an enemy, and we all need to fight this together. So palliative should be extensive. It should be beyond the grains you're giving. It should come emotionally. And then, for small-scale businesses, it's time the CBN and the others start thinking of how to re-engineer the economy, because a lot of persons has lost money. So these are part of the things. And that's why I say,
post-COVID.
Yes, whatever. As we move, even this period, as we move ahead.
I think this is a national call to duty, to responsibility, to faith in what we can do as a collective. This is a war that we may not defeat overnight, but we can certainly defeat if we all put hands on deck, because it is for our own benefit, individually and collectively. What we do good, or what we do that is good would definitely impact and energize the soldiers, both those in the forefront and those of us who are backing them from the background. It is, like I said, a call for national efforts from each and every one of us. Let's put in the very best of ourselves in this fight, and we can definitely defeat it.
We are brothers keepers. Whatever you have, share with your neighbors. The palliative is not just the responsibility of government and the private sector. Do whatever you can individually to help a neighbor, to help a friend, to help a family. That way we can weather the storm together, and this too shall pass. Well, thank you very much for coming on to the program. Josie.
It's always a pleasure. Thanks for having me.
Sam Kargbo, thank you for coming on to the program.
Thank you for having me, and indeed it's always a pleasure being here.
My name is Mayowa Oluwabi. Thank you for watching. God bless Nigeria.